Now we are joined by a Democrat who has been openly critical of the Senate health care bill, Dr. Howard Dean. Governor Dean, welcome to the program from Vermont. You heard David Axelrod here that this is significant reform, but something short of mission accomplished. What do you say this morning?
Well, let's start with the positive things. Over the last week, there were some things that were improved. David mentioned the so-called medical loss ratio, the limits on what insurance companies make, and that was true. That was added to the bill. It was in a form that the CBO wouldn't have allowed, and now it was allowed. It's not all that strong, but it's strong. We can expect some gaming by the insurance companies, but it's there. There were some cost control mechanisms that were gutted. They got restored. So there are some things here, but there are still big loopholes. The major cost control commission that was going to control costs, which had been gutted in the bill as of a week ago, is restored, except that it doesn't apply to hospitals, which of course are the biggest drivers of cost controls. Of cost increases. So the bill is better than it was, but it's still got a long way to go. Now I'm going to disagree with David on a number of things. The pre-existing conditions and the aging. The Senate bill says you can charge 3 times as much for somebody who's older than who's younger. Now the House says twice as much. In Vermont, it's 20% more. It's 1.2 times what an ordinary person pays. That's clearly not there is going to be insurance that's unaffordable. Suppose you make $70,000, $80,000 a year, you could end up paying $20,000 for your insurance under the Senate bill. So there are some big problems. Here's the major problem, David. We have committed in this last week of unseemly scrambling for votes, we have committed to go down a path in this country where private insurance will be the way that we achieve universal health care. That means we're going to have a 30-year battle with the insurance industry every time when we try to control costs and try to get them to do things. It is not a coincidence, David Gregory, that insurance company stocks, health insurance company stocks, hit a 52-year high on Friday. So they must know something that the rest of us don't.